Have you ever heard buzzing or ringing in your ears when there's actually no external sound? 1 in 10 adults have experienced this condition, known as tinnitus, and many elderly people suffer from chronic forms of it. It can be a serious problem that causes distress and triggers depression in its severe form. And it's been said that there's no treatment for tinnitus, but doctors in Japan are using this small device, which is proving hugely effective.
Japan is a world leader in cutting-edge medical technology and healthcare services. Join us as we explore medical frontiers. For more than 20 years, Sachio Ogawa suffered from tinnitus, a perception of ringing or other noise in her ears that made it difficult for her to have a conversation. 5 years ago, she finally came across a treatment that worked.
いろんな音が鳴ってる時もあります。ちっちゃい鈴の音がチリンチリンチリンって鳴ってる時もあるし、しばらく耳鳴りの薬っていうのを飲んでたんですけども、全然変わらなくて、収まりもしなくて、その同じ症状の人どんな感じで過ごしてるのかを見たり調べたり、自分なりにいろいろ調べたりしたけども、あんまり解決策はなくて。どんどんこう家にこもってっちゃった感じですかね。
Tinnitus is closely related to hearing impairment. Ogawa's doctor had her wear a hearing aid designed for people who have difficulty hearing. Sound waves enter the ear, causing the eardrum to vibrate. These vibrations reach the inner ear, which is less than 2 centimeters in size. The sound vibrations shake an inner ear membrane and stimulate hair cells that line it. The hair cells convert the vibrations into electrical signals, and these signals travel through the auditory nerve. When the electrical signals reach the brain's auditory cortex, we recognize the sound. When generating electrical signals, the inner ear responds to different ranges of sound. But if damage occurs to hair cells that respond to a specific range, the electrical signals for that range will be weaker. The brain will not be able to recognize them, and this leads to hearing impairment. The brain reacts by boosting sensitivity to electrical signals, trying to detect the weakened range. The heightened brain activity itself is recognized as the sounds of tinnitus. Hearing aids amplify the volume of the hard-to-hear sound range, boosting the electrical signals generated by the inner ear. The brain no longer needs to boost sensitivity, and this eases the tinnitus. Auditory tests showed that Ogawa had poor hearing for several ranges of sound. That's why her brain was constantly causing noise. Her hearing aid is fine-tuned with a computer. Patients use a hearing aid that's been adjusted based on the results of their auditory tests. This allows them to train their brain not to react excessively. Patients need to keep wearing their hearing aid for at least 3 months and see their doctor once a week.
脳っていうのはだいたい2ヶ月3ヶ月すると変わっていくって分かってますので、その期間かけるっていうことと、ただし一番大事なのはずっと補聴器をつけることです、ね、朝起きてつけて寝る時には外す、そういう長い時間つけることで難聴の脳、耳鳴りの脳を変えていく。
It took 1 year for Ogawa to get used to the hearing aid. Now, she no longer has difficulty with conversations.
補聴器を始めた後は、ほとんどなくなってきたってことですね。そういう辛さは
気に
ね。
ならなくなったことがすごいと思います。
あ、そうですか。わかりました。
This treatment method has been scientifically proven effective and is being promoted by a team of doctors led by Kaoru Ogawa.
Thank you so much for your time today, Dr. Ogawa. It was such a pleasure to have you on the program. Thank you.
よろしくお願いします。
So, Dr. Ogawa, how common is it to treat tinnitus using a hearing aid?
There are no medications that can treat tinnitus. A hearing aid is very good for people who have ringing and other noise in their ears. Its effectiveness depends on the severity of the tinnitus, but I think the hearing aid treatment has helped ease symptoms for 80 to 90% of patients.
But that's a really big percentage.
I brought a hearing aid with me. Would you like to try it out, Erica?
Okay. So how do I, that obviously goes on the back of my ear. That slides on the back.
How is it?
Yeah, it's, everything becomes incredibly loud, including my voice. It's quite, I think you probably have to get used to it. It's a little bit, maybe a little bit uncomfortable. Because different pitches, you're picking up different pitches and everything is amplified.
Yes, it amplifies not just speech, but all kinds of sound.
Sounds like you're shouting at me.
Hearing aids aren't like eyeglasses. They don't improve your hearing as soon as you put it on. When your ears are damaged and less sensitive to sound, a hearing aid would be uncomfortable for you. To hear better and more comfortably, you need to train your brain.
Can I take it out?
Okay.
It sounded like you were giving me a lecture. You were shouting at me. Okay. But it's amazing how it amplifies so much. And also, Dr. Ogawa, would you do it on both sides or just one side? Would you use the hearing aid on both the left and the right ear, or?
If the hearing aid is being used to treat tinnitus and the phantom sounds can only be heard in one ear, then it should be worn on that ear.
And what are some of the biggest challenges or difficulties with treating tinnitus? Because I think with tinnitus, it's something you can't escape. I mean, it's with you 24 hours a day. And obviously, during the day, you've got lots of distractions with different sounds. But at night, when all of the sounds die down, you've got this incredible ringing in the ears or buzzing in the ears that's constant. I would imagine that it impacts sleep as well.
You're right. As it becomes quieter around you, the noise in your ears becomes more noticeable. That, of course, can make it hard to fall asleep. This creates a situation where you're trapped in a vicious cycle. That's the problem.
The tinnitus-triggered vicious cycle is caused by interactions between different parts of the brain. When ringing or buzzing in the ear continues, the brain starts paying attention to it. The cause of the sound is unknown, so the prefrontal cortex, which deals with anxiety, becomes activated. Interactions also occur among the areas of the brain that feel distress and the part that controls uncomfortable memories. This can lead to depression and insomnia. Ogawa remembers an incident that made him realize how damaging this can be.
After I became an otolaryngologist, I went to the University of Michigan in the US and did research. There was one patient there who was suffering from a particularly severe case of tinnitus triggered by Meniere's disease. He became increasingly frustrated and angry and impulsively shot the doctor in the examining room. So tinnitus isn't just a simple ringing or buzzing in the head. Some sufferers end up committing suicide or hurting others because of the debilitating effects. It's tied to serious mental problems as well. Tinnitus can lead to depression, or it can give patients strong anxiety, making them unable to focus on anything but the sound of their ears. That's a big problem.
At Ogawa's hospital, clinical psychologists work with tinnitus sufferers so they don't develop mental problems.
耳鳴りが続くっていうことがすごい苦痛なんですよね。なんですか、普通の人は聞こえない耳鳴りが鳴ってるってそれだけかもしれないけど、なんていうんですか、精神的に本当にこの鬱陶しい感じがして、
実は耳鳴りしんどいんだけど我慢していろいろやってるんだっていうところを周りの人にもちょっと理解してもらいたいところなんですかね。
These sessions aim to relieve the suffering of the patients by allowing them to share their pain. Ogawa also holds seminars regularly for people with relatively mild symptoms, so they can better understand tinnitus. He also talks about the available options for treating it.
ですので教育的なカウンセリング、あるいは時にはこのグループによって行うカウンセリング。グループカウンセリング別に講演聞いたから耳鳴りが小さくなるという話じゃないんですけども、やっぱり精神的にですね、助かりますね。
Dr. Go, you mentioned group counselling. What sort of effect does group counselling actually have?
The thing about ear problems, whether it's tinnitus or hearing loss, is that they're not visible, so it's difficult for other people to understand what sufferers are going through. A sense of isolation and loneliness is one of the factors that can worsen tinnitus. But listening to the stories of other patients in group sessions helps people realize they're not alone. And sharing with others experiences and ways to cope with symptoms makes them feel better. That's one way to sever that vicious cycle that occurs within the brain.
So, Dr. Ogawa, what actually increases the risk then of tinnitus?
Tinnitus is caused by hearing loss. So, for example, listening to loud music for a long time, like some young people do, heightens the risk of hearing loss and tinnitus. In addition, our ears begin to suffer the effects of aging when we enter our 30s.
From the age of 30? Wow, okay, that's fast.
We can hear a very wide range of sounds from 20 hertz to 20,000 hertz. Aging first affects our ability to hear high frequencies, meaning high-pitched sounds. People who have damaged their ears with loud sounds tend to start suffering from hearing loss and tinnitus in their 40s or 50s. These days, the relationship between hearing loss and dementia is drawing a lot of attention. Because hearing loss and tinnitus are two sides of the same coin, tinnitus can also be considered a cause of dementia, or an early sign of it.
Because it sounds like the recipe for tinnitus and hearing loss is the modern lifestyle. Everybody's stressed, we're not getting enough sleep. If you start having tinnitus constantly, can you improve naturally or it's too late?
It's difficult to restore your original state. It's good if you can deal with it before the sounds become constant. In cases where you hear phantom noises only when you're tired, not when you're feeling energetic, you might still be able to reverse your symptoms, and that's the best time to get rid of them.
So, Dr. Go, how can you actually prevent both hearing loss and tinnitus?
First of all, sound is the major cause of damage for ears. So it's very important not to listen to loud sounds for a long time. Another thing is that the inner ear is a very small organ. The blood vessels carrying nutrients to it are also very thin. That means your ears can suffer damage if your blood is viscous due to high levels of fat or cholesterol, or elevated blood sugar. Avoiding or managing such lifestyle illnesses at an early stage is a way to prevent hearing loss and tinnitus. To that end, you should drink lots of fluids. But you need to expel it too, so you will need to sweat a little.
So exercise.
That's right, exercise. Take fluids and exercise to work up a sweat. If you don't have time to exercise, take a long bath at a lukewarm temperature so you can sweat. It's important to do things like that regularly.
Dr. Ogawa, it's been really absolutely fascinating. Thank you so much for your time today.
こちらこそありがとうございました。
Hearing aids may not help people with severe hearing loss. For such patients, a surgical treatment is available. 68-year-old Mamoru Takimoto lost most of his hearing in both ears. This happened in his early 40s after an illness distorted the shape of the bones in his ears. At the age of 45, he underwent surgery to have cochlear implants at his doctor's recommendation.
3ヶ月で急にわーっと挨拶ができるようになってね、わあこれはすごいわと思ってね、一番働き盛りの頃でね、もうそれでまあいっぺんに会話が戻ったからもう本当にこう大喜びでね、やっぱり一番は今の妻の声が一番嬉しい。
A cochlear implant has two main components. The outside component is a sound processor that works on a battery. The inside component is the actual implant, which is lined with electrodes. It is embedded under the skin, and the electrodes are inserted deep into the inner ear through a hole made in one of the bones. The sound processor is worn on the ear. It gathers sound and converts it into electrical signals. The implant delivers the signals to the inner ear. The signals then go through the auditory nerve that touches the inner ear and reaches the brain, where the sound is recognized. A new cochlear implant is being developed. It's much smaller than the standard type and doesn't require batteries. It's less than 2 millimeters in size. The new device is being developed by Takimoto's doctor, Juichi Ito, who has performed cochlear implant surgery on about 900 patients. It has a special material included in its center. This material generates electricity when it receives pressure. The new device is meant to be implanted directly in the inner ear. Sound vibrations add pressure to it, generating electricity. The electrical signals go through the auditory nerve and reach the brain, where the sound is recognized. In an experiment, guinea pigs were implanted with the device. It confirmed that hearing loss can be reversed.
外につけるデバイスも大きいし、中に埋め込むデバイスも、相当の大きなものです。これを全部一緒くたに全部鍵の中に入れてしまえばいいんじゃないか。電池変える必要もないし、それで聞こえたらまずそのコミュニケーション障害とかを少しでも防いで、いわゆる認知症とかですね、そういうものに対していいなと、防ぐことができるなと いうことが分かれば、まずそういうことが非常に社会に役立つんじゃないかと。
The ear has an extremely complex structure. Highly advanced skills are needed to safely embed such a tiny device deep inside it. The plan is to first develop a surgical method, confirm safety and durability, and then start clinical trials in 2 years.
Having a condition that others can't see can cause the sufferer to feel distress, not only from the actual symptoms, but also from the feelings of isolation and anxiety. Doctors are working to come up with treatments and at the same time provide support and help them to reconnect with people around them. And in that way, they're improving not just the sufferer's hearing, but also the quality of their daily lives. Today we're going to learn how to boost our entire brain to improve our overall hearing. And we have a very special guest. Today we're joined by brain specialist, Dr. Kato. Dr. Kato, thank you so much for your time today.
はい、こんにちは。
よろしくお願いします。
よろしくお願いします。
So, Dr. Kato, where actually is the auditory cortex in the brain?
聴覚は耳の近くにあります。
Okay, so
ここですね。
it's
両サイド。
basically behind the ears?
Yeah, just ここです。
The ear is here, and the auditory cortex is here, about 5 centimeters long.
5センチぐらい長いんですね。
It helps us recognize our location by hearing noise, sounds from nature, words we speak, all kinds of things. To do that, it stretches across both the right and left sides.
Today, we'll show you how to improve your ability to recognize sounds, not by curing your hearing loss, but by training your brain.
So, Dr. Kato, what's the first exercise?
First, while walking on a busy street, pay attention to the sound of your footsteps and listen carefully. This will help you to differentiate between the sound of your own footsteps and those of others, and improve your ability to select the sound you want to hear. Just by listening to your own footsteps, you can stimulate not just the auditory cortex, but other parts of the brain as well, including the area that judges direction and the part that recognizes sound.
Now I'm going to start focusing on the sound of my own footsteps. Yeah, I think it becomes louder, it becomes more pronounced because you're focusing on it so much. It does. It becomes louder, it becomes more pronounced, you can hear it more. You can shut out the external sound and I think you can hear footsteps more.
Second, pay attention to the sounds of nature. You'll realize that we're surrounded by so many of them. You want to breathe slowly, like 1, 2, 3, and so on. That relaxes the muscles throughout your body. Then you can focus on your hearing, and your hearing becomes more sensitive. When various parts of the brain are working hard, the auditory cortex can't relax. By relaxing your body, you can better focus on listening and improve your brain's sensitivity to sound.
I think when I first arrived here, I'm still thinking about the last interview or the next interview. My mind's still busy. But then when you actively slow down, you can hear different depths in the sound, different pitches, more, I think, variation in sound. So I think it's really effective. So, Dr. Kato, are there any exercises that we can do at home?
Yes. Let me first show you something very simple. Close your eyes and raise one of your knees. Relax and count to 20.
Try doing this on both sides with your eyes closed. By shutting off your vision and focusing on balancing your body, you can sharpen your sense of direction. You train your ability to tell which direction a sound is coming from.
Yeah, there's a lot of little sounds I'm picking up now from different directions.
その通りです。
So, Dr. Kato, when would you do this? Would you do this every day? When would you recommend doing this sort of training?
First thing in the morning, when you're still sleepy, you can do the one-leg stand to really wake yourself up. That will help you have an easier time talking to people.
Okay, great. So do it first thing in the morning.
Yes, that way you can improve your grades at school or performance at work.
What's the next exercise?
Next, we'll use our ears. Mine are kind of big. Anyway, stick your fingers inside and pinch your ears like this. Stick out your elbows. Then squeeze your shoulder blades together, slowly. 1, 2, 3, 4, 5. By pulling this part, you loosen the muscles around your ears. That helps you to hear better.
I thought it was also to impact the ears as well.
You also stimulate pressure points around here. When you stretch the muscles that you don't usually use, your body relaxes, and your ability to hear improves.
So it's been so interesting, and I think there's really practical, easy exercises.
Most of us are stuck in the same daily routines. We run our lives on autopilot. That can be easier on the brain, but when things get too easy, its abilities decrease. If you change your lifestyle a little, say by getting up or going to bed half an hour earlier than usual, you can revitalize your brain, and that helps you hear better. What's most important for your hearing is newness and freshness.
So thank you so much for your time today, Dr. Kato. It's been such a pleasure having you on the program. Thank you.
Thank you.